What if I tell you that if you are reading anatomy for 60 to 70% of your study hours and still thinking that you are on right pathway, then my friend, you are doing bullshit in your life. And I am not denying that anatomy requires some extra effort from your side in comparison to physiology and biochem. But if still you are reading like that, short head of biceps arises from the lateral aspect of tip of coracoid process, and long head arises from the supraglenoid tubercle of the scapula, then you are doing a bullshit thing and you have to do a lot of hard work to fetch bare minimum marks in your exam. Hi friends, I am Ravikant Seni, a final year medical student at TSIC Bangalore. So in this video, I'm gonna tell you that what and all mistakes you are doing while studying anatomy and how can you improve it. So let's start the video. First point is right use of dissection hole. अगर आप अब भी डिसेक्शन हॉल में बस पीछे खड़े होके चिट चैट करने जाते हैं, या फिर अगर डिसेक्शन हॉल में कुछ देखा भी तो उसे अपने घर पे आके, हॉस्टल में, रूम पे आके उस जो भी स्ट्रक्चर आपने कैडेवर में देखा उसको बुक में आके रिलेट नहीं किया, तो माय डियर फ्रेंड्स, यू आर डूइंग वर्स्ट थिंग इन योर लाइफ. So like what you have to do is just a simple thing you need to do is whenever you get a chance to touch the cadaver or dissect the cadaver, and anyhow like in starting of dissection hours and or later stage of dissection hours, if you're able to touch that structure, just open a PDF or textbook, either atlas or normal textbook, and try to find out those structures which are given in your textbook into the cadaver. एंड बिलीव में अगर आप ये कर लेते हो ना, तो मतलब आपको जो विसरल ऑर्गन्स हैं उनको भी इमेजिन नहीं करना पड़ेगा उनके मतलब अरेंजमेंट को. आप जस्ट बुक में देखो एंड कैडेवर में देखो, यू विल गेट ए परफेक्ट मेमोरी इन योर माइंड. एंड लाइक इससे अच्छी मेमोरी कोई होगी नहीं. एंड अगर आप ये मेमोरी गेन कर लेते हो अपने माइंड में, तो इट विल लास्ट फॉर लॉन्गर. एंड लाइक आपकी फर्स्ट ईयर में, एक बार फर्स्ट ईयर में पढ़ लिया तो आपको दोबारा से रिवाइज करने की भी इतनी ज़्यादा नीड नहीं होगी. एंड बट आई नो कि इसमें भी आप लोगों की बहुत सारे एक्सक्यूज देंगे कि हमारी कॉलेज में तो लाइक फॉर वन कैडेवर वी आर 30 to 40 स्टूडेंट्स, सो वी नॉट एबल टू सी द स्ट्रक्चर वॉट एवर द प्रोफेसर इज टीचिंग. बट इसका सोल्यूशन भी है मेरे पास. इसके लिए PW मेथड आपके लिए लेके आया है रियल टाइम डिसेक्शन वीडियो, जिसमें आप कोई भी बॉडी के स्ट्रक्चर के डिसेक्शन वीडियोस दे सकते हो. नॉट इवन लाइक फॉर एनाटमी ओनली, you can access the practical videos for biochemistry or physiology, and along with these theory lectures which are in crisp and concise manner, and you can also solve the question bank to test your knowledge, and वो भी just एक minimum price में. and if you use my coupon code then you will get extra discount. so wait किस चीज़ का कर रहे हो, अभी जाओ and log in to PW Med app and buy that Prarambh batch for first year and use my coupon code RAV700 to get extra discount. And believe me, if you follow this rule for 1 month, then excluding Sundays, at the end of 1 month, you like knows the 25 to 26 topics in your anatomy. And इसके लिए आपको daily 3 to 4 hours भी नहीं देने पड़ेंगे anatomy. Just 15 to 20 minutes giving your anatomy after dissection hole. And if you do for some days, then without studying more, you know the 80% of your anatomy. And if you paste it in your answer sheet with diagrams and only diagrams, then you will get around say 70 to 80% marks. Because if you draw a diagram in anatomy answers, then professor or examiner see those diagrams only. If diagram is correct, then he will give 70 to 80% marks. He will not only read the theory only. So just focus on more on diagrams only and not my words. आप जो कैडेवर से सीख लेते हो ना, वो आपको इस दुनिया में कोई भी प्रोफेसर, कोई भी टेक्स्ट बुक आपको नहीं सिखा सकती. That's why they say cadaver is the best teacher in the world. Let's come to second point, right approach. So the first mistake most of the medical students did in their first year, that they, whenever they want to study the anatomy, they just sit with their books and first reading and mugging up the theory, and then shifting to the diagram and then mugging up them. My friends, you have to know that one thing, that anatomy is not like a theoretical subject or a conceptual subject where if you anyhow memorize the theory or memorize the concept, your job is done. But anatomy is a structural and organized subject, and anatomy is the easiest subject because you can relate everything on your body. So what you have to do is, like whenever you want to a certain topic to study in anatomy, then just first open your Netter's atlas or any other atlas which you have, and either a soft copy or hard copy. Then understand that diagram and try to identify like relate that diagram in your body. If you are like, suppose if you are reading some external structures like muscles and all, then you can like, for For example, if you are reading muscles, so just relate that diagram with your body. Like, okay, this is the sternocleidomastoid muscles, this is external head, clavicular head, and this upper end is attached to the menstrual process. So your job is done. And but in case you are reading visceral organs, then you can't like touch and feel the organs in your body. So what you have to do is like just imagine whatever you are seeing in that your atlas, and imagine that okay, in body these structures are organized and arranged in this such a manner. And then go to your textbook where you see the line diagrams of same topic, and after reading the line diagram in your textbook, you're able to paste in your exam or in your notes. And if you do that much, then your 60 to 70% of topic will get covered. And after that, read the theory aspect of that particular topic to deep dive in that topic. And believe me, if you approach the anatomy in such a manner, then by doing this, the most of the memory of that topic is stored in your mind in the pictorial format, and a very little memory is stored in the theoretical format. So if your mind is like store the information in pictorial format, then you will like have to struggle less while you are memorizing that topic, because that pictorial memory is still longer in your mind. And if you read the anatomy in that same approach, then you have to give less hours to your anatomy, and you can save your time and read other subjects. Like if you're reading first theory and then going to like after mugging up the theory and going to mug up the diagram, then it take a 1 hour to cover a certain topic. Then if you go in opposite way, like first reading the understanding the diagrams and relating to your body and then going to theory, then you will able to cover that same topic in 30 to 40 minutes, and results will be in front of you whenever you're going to give your exams or any internals exam or university exam. Make use of small time slots. Let's suppose you are going out for an party and you have left 15 to 20 minutes extra with you in your room, and you are waiting for your friends, and in 15-20 minutes may you are thinking that I'm not able to read subtopics, so just you are sitting and scrolling the reels. So instead of this, what you have to do is like just take a paper and draw the diagram whatever you learn in your previous days, or just open a textbook and learn a new diagram in 10 to 15 minutes. And ऐसा करोगे ना यार, तो मतलब in those small slots of time you will able to learn a lot of things your anatomy. If you're doing these things also, then in the end of your year you like not feel the burden of anatomy to cover the anatomy before your prof exam, before one night of the exam. Study bare minimum. Like if you are a student who's like just busy in polishing your skills of your passion or learning new skills, and you are not interested to sit for hours and reading a subject, so in this case also I want your 10 minutes a day only. Like whenever you get bored of like polishing your skills or learning new skills, then what you need to do is just sit, open your textbook or atlas and draw a diagram and learn it and try to like understand that diagram. And if you do such small things in your daily life, then before an exam you have like 60 to 70% of knowledge of your anatomy in your mind. You just need to read theory and just recall those diagram before the exam. Next point is teach your friend. Like whenever you get time, or I say like make a habit like when to teaching a friend. Like you read a one topic and ask your friend to read another topic. Just find a common time and just teach your friends. Like whenever you get time, just pick up a marker or draw it on whiteboard or a paper. Or better way to teach your friend is draw that diagrams on your friend's body. Like in simple words, find your प्रीति. So like ये करने से आपको क्या होगा कि जो मेमोरी होगी वो पर्टिकुलर टॉपिक से रिलेटेड वो और ज़्यादा स्ट्रॉन्ग होगी. Like if you read a topic and in any way, then your memory, let's suppose, lasts for 40 days. But if you learn a topic by diagram approach and then theoretical approach, and after that if you teach your friend, then that memory lasting for 60 to 70 days. So अगर आप अपने फ्रेंड को पढ़ाते हो तो आपके फ्रेंड का भी बेनिफिट होगा और साथ ही साथ आपका बेनिफिट भी होगा. तो नॉट बी ए जेलस लाइक आई रेड देन व्हाई शुड आई टीच माय फ्रेंड. आई एम डूइंग हार्ड वर्क एंड ही जस्ट सिंपली लिसनिंग एंड गेट टू नो एवरीथिंग. अगर आप अपने फ्रेंड को पढ़ाते हो, सिर्फ आपके फ्रेंड का बेनिफिट नहीं होगा, आपके फ्रेंड से ज़्यादा बेनिफिट होगा. तो अगर फ्रेंड के लिए नहीं तो एटलीस्ट खुद के लिए वर्क कर लो. एंड अगर आप ये वीडियो अब तक देख रहे हैं, मतलब आपको ये वीडियो इंटरेस्टिंग लगी एंड इन्फॉर्मेटिव लगी, सो टू मोटिवेट मी टू मेक सच मोर वीडियोस, लाइक द वीडियो एंड हिट द सब्सक्राइब बटन. एंड नाउ इन दिस वीडियो माय जॉब गेट डन, बट If still you have any confusion, you are facing any problem in reading anatomy, physiology, biochem, or any other subject, then you can reach me out on Instagram or Telegram. I will try my 100% to help you out. Anyway, thanks for watching the video and supporting me. I will catch you soon in next video.